All right, so in this video, we are going to be demonstrating how to remove a nasogastric tube. So I'm going to go ahead and knock on my patient's door. I'm going to foam in using hand hygiene. Hi, Mr. Smith. My name's Carla. We're going to be taking out your NG tube today. We have verified the orders and the doctor has given us the okay to do that. And the patient's very happy because he does not like having that NG tube in. Can you tell me your name and date of birth, Mr. Smith? All right, very good, thank you. So the few supplies that you need to remove the NG tube, you're gonna wanna have your stethoscope again to perform another assessment. You can have a pad to go ahead and place on the patient's chest, gloves, and then also some Kleenexes. After you remove the tube, you can use those to give them to the patient, and also supplies to do oral care. All right. So I have provided for privacy for my patient, and then I'm going to go ahead. I've already kind of talked to him about what removing the tube looks like. I'm going to position him in a high Fowler's position, meaning sitting up at a 90-degree angle. This is as high as the bed gets, so we're going to imagine he's sitting straight up. I'm tall, so I'm going to raise the bed up to working position, and then I'm going to perform my abdominal assessment. So I'm going to go ahead and I'm going to listen to your abdomen here. So I'm going to inspect. By now, with the NG tube in, we would expect that there should not be any distension in the abdomen. So I'm going to go ahead and inspect, and then I'm going to go ahead and auscultate all 4 quadrants. You have good bowel sounds, Mr. Smith. All right, and from there, I'm going to go ahead and palpate. Go ahead and put my gloves on. Do you have any pain or tenderness? No? All right, very good, thank you. All right, so I'm going to get him covered back up. And then I'm going to go ahead, it's a good idea to put a towel or a pad over your patient's chest in case any body fluids come out as you're removing the NG tube. Okay, so the next step then is we're going to work on removing the tape. So we're going to go ahead and take that off. There's tape on the cheek. We're going to go ahead and remove that. And also any tape that would be secured to the gown, we're going to remove as well. And then we're going to, as we remove this, I like to use my left hand, but either hand, we're going to instruct the patient to take a deep breath and exhale as I pull this out. So Mr. Smith, if you could take a deep breath and exhale, I'm going to just pulse a steady, smooth motion on pulling it out. Okay. And then I'm going to inspect it. I want to make sure the tip looks like it's intact. Instructing my patient to breathe normally. I'm going to dispose of this in the trash. I'm going to offer the patient tissues to help clean, provide oral care for them. All right. I'm also going to go ahead and make sure I'm leaving my patient safe. So I'm going to put my bed in low lock position, make sure they have their call light, they're comfortable, and then side rails up, and then I'm going to do my documentation.